Thank you all for being here today. Yesterday, we identified 5 new cases of COVID-19, the new coronavirus, here in Wake County, all linked to a Boston conference last month. That brings our state's total to 7 presumptive positive cases. We anticipate more positive test results from this Boston conference. Right now, we have supplies to test 300 more people. And like other states, we're doing everything we can to get more supplies and more tests to our state. Private labs like our own LabCorp here in North Carolina are already testing. And we are working on another mechanism of testing that does not rely on these supplies. We've analyzed the situation using available data and science. We've discussed options with health experts, business leaders, and emergency management here and in other states. The new cases and the advice of these experts have led us to give new guidance to North Carolina residents and to declare a state of emergency for our state. While we do expect many more cases, we can limit the number of people who get seriously ill. The main purpose of declaring a state of emergency is increased flexibility to respond and prevent, as well as to allocate funds where needed. The state of emergency can help speed supplies and gives health and emergency managers more budget flexibility. It protects consumers from price gouging. It encourages insurers to make testing available for little or no cost. And it expands the ability to use more health professionals who are working to respond to this virus. Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, will speak in a moment to outline today's new recommendations about workplaces and large gatherings. This new guidance is especially important for people older than 65 and those with a chronic health condition. Even though we know that that population is most vulnerable, I ask all North Carolinians to take this seriously. For example, though most young people who have contracted the virus have experienced milder symptoms, they are not immune. Anyone can carry the virus to loved ones or friends who could become ill. Protecting public health means being cautious and being prepared. Today we are both. These recommendations can mean inconvenience, loss of income, or disappointment, but they are based on the best medical advice, and they will be life-saving. We do want people to take this seriously, but we also want them to go on living their lives, particularly those who are not in the higher risk group. We just need them to do it wisely. Here are some steps that everyone can take to protect yourself and your family. Wash your hands often and avoid touching your face. I know we're all doing this more now, but I urge you to continue to do that. Cover your mouth and nose when you cough or sneeze. Clean and disinfect surfaces frequently. Stay at home if you're sick, and have a plan in case you need to miss work. Avoid mass travel and large gatherings if you are in a higher risk group. Finally, here's where you can get the latest information at our North Carolina Department of Health and Human Services website. It's ncdhhs.gov/coronavirus. I know that people are worried about this virus, and I want to assure you that the state of North Carolina and your public health directors and emergency responders are working hard. Our most important work is keeping people healthy and safe. I'm joined today by the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, the North Carolina Emergency Management Chief of Staff, Will Ray, State Public Health Director, Dr. Elizabeth Tilson, and the Secretary of the Department of Public Safety, Eric Hooks. Emergency Management Director Mike Sprayberry is in Robeson County at a legislative hearing on hurricane response. Lee Williamson is our sign language interpreter today. I want to recognize Dr. Cohen to go over these recommendations, and then I want to recognize the Chief of Staff of the Department of Public Safety, Will Ray, to talk about the emergency management side. So, Dr. Cohen.
Thank you, Governor. So the actions and recommendations we are sharing today are to help us slow the spread of this virus and protect our more vulnerable neighbors. We each play a role in keeping our communities safe and healthy. And we understand these actions are going to have impact on people's lives and our communities. And we're making them based on guidance from the Centers for Disease Control and Prevention, current actions from other states, and the most up-to-date epidemiology evidence that we have to protect our public health. This is a critical moment in the growing outbreak of COVID-19 in North Carolina, when such measures can potentially impact the spread of the disease. Many of the recommendations we're making today are targeted, as the governor said, at protecting people at high risk of severe illness, which includes adults over the age of 65, those with underlying health conditions including heart disease, lung disease, diabetes, or with a weakened immune system. So here are the recommendations we're making statewide. People at high risk, and by again that means above the age of 65 or with underlying health conditions, should avoid large groups of people as much as possible. These include gatherings such as concert venues, conventions, church services, sporting events, and crowded events, social events. Second, facilities that serve as residential establishments for high-risk persons should restrict visitors. This would include places like independent and assisted living facilities, correctional facilities, nursing homes, and facilities that care for medically vulnerable children. We are encouraging also statewide that event organizers should encourage anyone who is sick not to attend, and to encourage those who are at high risk, described as earlier, above 65 or with more chronic health conditions, to not attend those events. We encourage event organizers to adopt lenient refund policies for people who are at high risk. Find ways to give people more physical space to limit close contact as much as possible. Encourage attendees to wash hands frequently and clean surfaces with the appropriate cleaners. Additionally, travelers returning from countries and U.S. states impacted by COVID-19, please follow the DHHS guidance on self-monitoring. Again, that is available on our website. And so that is our guidance for the entire state of North Carolina. But as you know, as the governor mentioned, we confirmed 5 new cases of COVID-19 in Wake County, increasing that total to 6 in Wake County. And therefore, we have some additional recommendations for those of us in the Triangle area. First, employers and employees in the Triangle should use teleworking technologies to the greatest extent possible. Additionally, employers should urge employees to stay home when they are sick and maximize flexibility in sick leave benefits. We ask employers to consider staggering start and end times to reduce large numbers of people coming together at the same time. Obviously, we know that many people, like those who work in restaurants and teachers, cannot telecommute, and we are not recommending that at this time. Second, organizers of mass gatherings for events here in the Triangle that primarily target or draw high-risk persons, including those that attract older adults, should consider canceling or postponing those events. I want to address schools specifically. The good news is that children appear to be at low risk of serious infection with the virus. This is a different situation than we had during the 2009 H1N1 pandemic. This is why we are not currently recommending preemptive closure of schools. However, the closure of schools might be necessary in some specific circumstances during the course of this epidemic. For example, closure may be recommended when there is need to do any sort of public health investigation, or a case of cleaning is required after exposure in a school or child care setting. And I remind us that this situation is rapidly changing, and recommendations about school closures could change as we learn more. But today, we are not recommending any preemptive school closure. And we know that decisions around school closures are always difficult to make. And we're committed to working with school leaders to determine what is in the best interests of their community moving forward. Perhaps the best thing we can do to all protect ourselves, our neighbors, and our state is to be sure that we are getting accurate information. I'm worried about the misinformation that's being shared across social media. It's harmful. Please rely on trusted sources of information. We are updating our website, ncdhhs.gov/coronavirus regularly. You can also go to the CDC website. Let's be guided by compassion and reason and work to support each other as a community. Thank you.
I'll now recognize Will Ray, the Chief of Staff of the Emergency Management.
Thank you, Governor. Good afternoon, everybody. We wanted to briefly just talk about some of the actions that we're taking here as the Department of Public Safety partners with the Department of Health and Human Services to make sure that we are postured appropriately so that we can protect the residents and visitors of North Carolina. As you're aware, last week we have activated our Joint Information Center here at the State EOC to make sure that our messaging and public information going out is coordinated. We're taking an additional step this afternoon, and we are activating the State Emergency Operations Center later this afternoon, so that this enhanced posture will allow us to leverage our all hazards and scalable response framework that also allows us to access the respective capabilities and resources of our state emergency response team partners from across public, private, and nonprofit sectors. We will remain in this posture throughout the event, and again, this is to make sure that we are forward-leaning, to make sure that resources are where they need to be as quickly as they can be, again, to make sure that we are protecting those residents and visitors of North Carolina. And I would also like to echo Secretary Cohen, please make sure that you are seeking out reputable sources of information as it relates to coronavirus from either the Centers for Disease Control and Prevention, from the State Health Department, or your local health department. Thank you, sir.
We'll now take questions for anyone on the podium. Yes.
Gary Robertson, Associated Press. One of the big events this week is the ACC tournament. That's special to you and a lot of other people. Have you talked with the ACC, and is there a concern just about the economic impact something like this might have? Because a lot of donors go to these events, they're older, et cetera.
I talked to Commissioner Swafford, and I know that Secretary Cohen has as well. We want people to follow our recommendations. And Secretary Cohen, I think you had the most recent conversation with him, or Dr. Tilson did, sorry. Dr. Tilson did, so Dr. Tilson, I'll recognize you.
Yes, Commissioner Swafford and I have been in close communication for the past couple of weeks, and looking ahead to the ACC tournament. We spoke this morning as well. He is aware of these guidelines and is appreciative of them. And
Governor, I heard someone talk about people returning to North Carolina from international travel. What do you say to people who plan to travel internationally in the next week, month, 8 weeks, 12 weeks?
Well, I would ask them to follow the recommendations that we are putting forward and the recommendations of the CDC. There's certain countries where you should not travel, and people who are in the higher risk groups, we're recommending that they don't travel unless it's essential, is what we're recommending.
And I also wanted to follow up, please. I heard the Chief of Staff say that you're going to remain in emergency mode throughout this event. Do you have even a guess as to how long that's going to be?
I'm going to let Dr. Cohen maybe give a response to that.
And I'd also say that the travel guidance for folks was also put out by the CDC yesterday in terms of high-risk individuals not traveling. But in terms of how long do we think we'll be in this activated posture, I don't think anyone could know the answer to that question. My hope is as short a time as possible. I think we are looking to what is happening internationally right now to get some sense of things. I think we are seeing less and less new cases every day in China, which is a good sign. So they've had about a 2-month episode of intense activity here. And so we are planning for this to be an extended posture, which is different than a hurricane kind of posture. So we're all going to have to be sensitive about the fact that this is a marathon.
So it could be months.
It could be months.
The one Hobart WTBD, how long can this virus actually last on the surface of anything? Are people able to spray anything to keep themselves safe?
I'm going to let Dr. Cohen or Dr. Tilson answer that, but first I want to respond to something that I had asked earlier. I think it's important for the Emergency Operations Center for co-location. Having the public health people move over here and integrate with the business community, with the nonprofits, with the emergency managers. It works so much better when everyone is in the same place and everyone is communicating with each other, and that's why we want to open this. And I think the public health officials were looking forward to getting this done because we were operating in separate places, and activating the Emergency Operations Center is very important in that regard. And I'll let one of you guys talk about that.
Yes, sir. Still learning more about this virus as well, but also looking back at what we know with other coronaviruses, probably a matter of hours, 3 to 6 hours. And then there is a list of approved disinfectants that should be used for surface cleaning that's available on our website.
Governor, the state has county health departments to only report positive cases, not any suspected or tested cases, and if so, why is that?
I'll let one of you guys answer that.
Sure. So we at the state are reporting positive cases at this time. We've done a number of tests on folks who are ultimately negative. I think that we have seen in the first number of cases that we have identified, unfortunately, those individuals were able to be identified by us sharing just their county, their age, and their gender. And unfortunately, they've experienced some harassment, which is totally unacceptable. And so we want to be sure that we are protecting folks' privacy as we move through this, but also sharing transparent information to protect public health. We hope that we are achieving that balance. We're going to be having as much communication as we can as we move through this.
Governor, to follow up on Gary's question, Cullen Browder, WRAL, you're a big sports fan. Do you personally plan to go to the ACC tournament? You're a Canes fan. Do you plan to go to Canes games? And what would be your advice to those who are not in the high-risk category?
I would plan to go to sporting events and to mass gatherings myself, not being in the high-risk category. You know, I think people have to make their own decisions about that, and remember that these recommendations may be evolving as we see more and more about what's happening, but you know, we're making no recommendations about canceling anything. We're just talking to the public at large, the steps that we want to take at a mass gathering that you may have, of having hand sanitizer and making sure that you try to separate people as much as you possibly can. But no, we're not making recommendations of canceling mass gatherings.
And I had a follow-up in regards to testing. Can you give us a sense? You talked about the 300 tests available. Can you talk about how many so far, and what is, with the ECDC guidelines, what is the criteria for who gets tested and who does not?
Betsy?
So in terms of the criteria, as you know, the CDC had criteria of symptoms and then some sort of epidemiological criteria, which was left to the state to decide. Because of our trouble in getting some sufficient supplies, we had the criteria of that you had traveled to a high-risk area, that you had a known contact with someone who was positive, and also that you had a respiratory illness that was severe enough to be hospitalized. That was the criteria we're using, but we have opened up that even more as of today, and so we'll be having more people being tested as of today.
But who would qualify now?
Our epidemiologists on team will be working one-on-one with the providers that are calling, and they'll be making those judgments one by one.
Do you have numbers yet on how many you've conducted so far?
Yeah, we have 44 people who are already being tested and 25 who are already pending in the lab today, and we'll be ramping up those numbers.
To follow up while you're there, we had a viewer email us and say that he is a physician's assistant, lives here in Wake County. His daughter was on a school trip, an adult daughter, older daughter, in South Korea, had gone early to enjoy some of the country before this program started. They canceled the program, recommended everyone fly home. She flew home with cold-like symptoms, is how he addressed this, and she was wearing a mask. And never really she told people she was coming back from South Korea. Nothing really happened on her stops, even including Atlanta. She gets back here. The parents are concerned. They call the hotline, and soon a doctor calls. He's not sure from where that doctor called, but it was in response to the hotline. And he wanted to have his daughter tested, and they said that she's not showing the exact symptoms that shouldn't be tested. I have to ask, how could someone coming from a hot zone like that, who shows any kind of flu-like or cold-like symptoms, not be tested?
Yeah, and without really knowing the specifics of that conversation, but in general, that there's criteria of fever as well as signs of lower respiratory infection. So not just no fever and a runny nose, but fever and lower respiratory infection. So it may have been that hadn't met those clinical criteria.
I could get that for contact, casual contact, or even close contact, but somebody coming from a hot zone, shouldn't anybody who comes from a hot zone back to North Carolina who has any kind of symptomatic issues like that be tested?
Well, again, we're following the CDC guidelines as well, and they're saying fever as well as symptoms. So that's what our epidemiologists are using, that CDC guidelines on assessing who should be being tested, at least the ones coming through our lab.
And how are you all addressing coronavirus as temperatures start to warm up and people tend to let their guard down, especially when it comes to the flu?
Yeah, so there's a lot of questions about as it gets warmer, what will happen, and will we see that seasonality with this novel coronavirus with other viruses? And so just a little bit of a context, and we'll get to that specific, that there is the flu and cold season is a real thing, because most viruses survive better when the air is cold and dry and there's less sunlight. So we do see a seasonality of viruses, including the coronavirus that circulates regularly. It's hard to know if that will affect the spread of the novel coronavirus. We don't know yet. We hope that maybe with it's the warmer air and the more humid air that allows it to circulate more easily, or less easily, and also having more of the UV radiation from sun that we get in the warmer times. Maybe that will help decrease the spread of the novel coronavirus. But we don't know yet. We're hoping, but we don't know yet. And the other piece with the novel coronavirus, unlike our other circulating viruses, is that nobody has that underlying immunity. And so that still makes it easier to spread. So we will see if there is a seasonality decrease, but we're not sure. We're not sure yet.
I have a question.
And then I'll have another question here. Assuming people don't follow these guidelines that you do have, or even ones from the CDC, is there a fear or concern that this might put a strain on our healthcare system, depending on not only how many ICU beds we even have in the state? Like, this could potentially be a huge problem. Is that something that there's a contingency plan in place?
Absolutely, and that's part of the contingency planning with our emergency management system. We've been doing hard work on that for the past 2 months, understanding where's our scarce medical resources, how do we triage, so very intense planning with our hospital preparedness team through emergency management.
What is that plan?
Do you want to speak to that? Or, okay.
So I think the specific data points you were asking about are things that we are monitoring daily with our healthcare partners, again, so that we can trend and make sure that we're ahead of potentially any scarce resources. We've had planning teams, as Dr. Tilson said, that have been working on some of the procurement needs, potentially some of the alternate care locations or other methodologies to try to mitigate some of the healthcare impact on our to mitigate some of the impact on our healthcare system. So those are conversations we're having daily with our healthcare partners, both EMS and hospitals.
Have you identified any areas yet?
Any specific areas that are dealing with shortfalls? Is that your question?
If it got to that point where you need like that.
Understood. So I think those are planning factors that we're using as we have these discussions. I don't necessarily know that at this point we're able to share any specific locations.
There's been, I'm sorry, go ahead.
I'm just gonna add to that in terms of our preparedness with our hospital partners in particular. I've been in contact with nearly every CEO of our major hospital systems across the state. All of them have stood up task force within their own hospitals to respond to COVID. They've been running tabletop exercises. Those are things that now that we are activating with the emergency order, activating the emergency operations center, you're going to see those kick up into higher gear now. But know that folks have had pandemic plans, and they are activating those.
There's been some guidance over the past several days on people who are traveling from impacted countries and other states that have states of emergency. North Carolina is now one of those states. For instance, UNC has basically told students who travel to states of emergency that they need to self-quarantine when they return. What will they do now?
Yes, so the guidance we are putting out today, as I mentioned, is asking any returning traveler, both internationally as well as domestically, that they're coming from places where we're seeing community spread, to do the self-monitoring that is on our website. And that includes things like making sure that they're being very aware of their symptoms. Are they having any fever, lower respiratory symptoms, cough? And if so, to get in touch with their provider if they would have those symptoms, to isolate themselves and get in touch with their doctor at that time. Doesn't mean that they need to be quarantining themselves. Again, quarantine is the term that is used for people who are well, but need to be isolated. Isolated is when you're already sick. So we're not asking folks to quarantine, but what we are asking folks to do is self-monitor so that they can quickly be identified.
But for UNC, when they were basically telling students who had traveled to, for instance, California or Florida coming back from spring break, that they would need to self-quarantine for 14 days. Since we're now a state of emergency state, what would be your recommendation to UNC?
So I'd have to look at exactly what UNC is recommending, and I would say, one, we're very lucky that the interim chancellor of UNC, Bill Roper, is a former head of the CDC, so incredible public health expert there. So we are in constant contact. I've talked with Dr. Roper over the last number of days, and so we're trying to be in close contact to make sure we understand what they are doing, and that we are aligned. We know that different institutions are going to make decisions. We are putting out the guidance for the whole state and for the Triangle area. There are folks that may want to go beyond those for protection purposes. We welcome that, but these are the ones that we feel like are appropriate for the state at this point.
And I had a follow-up on those who have been identified, tested positive, and those who are still waiting. Can you explain what their status is? What's the conversation with them? Isolation versus quarantine, please.
So anyone who has reached the stage of being tested, it means, as Dr. Tilson mentioned, they are having symptoms, so they are being isolated. So when someone is having symptoms and we are suspecting a positive, they are being isolated either at home or in the hospital, depending on the severity of illness. That's right.
Dr. Cohen, I had a question for you regarding your call with the CDC last night. You had said this morning you felt like you all were talking past each other regarding the testing issue. Did you get any clear indication of when you think North Carolina will have the supplies you feel like are adequate to do testing for what we want to be able to do?
Yeah, the supply issue is not unique to North Carolina, and I think it is something that these, and when I say supplies, I think I want to be, they are chemicals. They are the chemicals or the reagents that are used by our lab to run the tests. It is not the swabs that are the things that take the samples from patients, just to distinguish. And so there is a number of states, including ours, that are relying on a particular testing methodology that needs these particular chemicals. Unfortunately, that supply is on back order. We tried to order from the CDC. We're ordering directly from the manufacturer. We're getting some in. I think the more productive way forward for us in the state is we're actually bringing up a second testing methodology. We're waiting for the FDA to give us final approval on that, but we want to be ready to go as soon as that it's approved. I think that is the way that we can get around the supply issue, because that other testing mechanism does not have us rely on this original supply. I think at first folks were saying, we're sending you the kits, and I don't think they understood at first what exact part of the supply chain that we needed. We needed extraction kits. And so we are now clear that we are communicating that's what we need. It doesn't mean that there isn't still a supply issue, but I think everyone is understanding what the issue is now. And again, we're focused on partnering with private labs like LabCorp, like Quest, as they ramp up their capability, and then us looking at a new testing method for us to that doesn't have us rely on those same supplies.
And this may be a question for the governor, but with the recommendation of the triangle that people telework as much as possible, what changes are you making in state government to have employees be able to do that?
The executive order deals with state employees, and it is very similar to the recommendations that are made in the executive order. Our HR department is going to come forward with more specific recommendations, and some departments, depending on what they do and how they do it, it may be different. Different agencies may need to make different specific decisions, but we do know our state employees are working hard on this very issue, and others who aren't certainly deserve the same kinds of protection. I want to address one more time the testing issue that Ed brought up and that you brought up, Michael, as well, is that there's no question that our public health officials want to expand greatly the testing criteria. The problem has been that they have not received the supplies from the CDC that they had been promised and that they anticipated. Therefore, they're working as hard as they can to find new ways of testing and find other sources. So, for example, even though we have a shortage of this supply to run these tests, we also have another way we can do it that doesn't require those supplies that we're working on to try to get approved that would allow us to open the criteria even more. In addition, LabCorp, which is incorporated and located, not incorporated, but located, headquarters located here in North Carolina, they are now producing tests and are sending them to providers for testing. And we are encouraging private labs to continue to produce tests so that we can be more widespread. You know, right now, when someone has illness, it's more likely that they would have a regular type of flu, and they test for those things first. But particularly people in this high-risk area, if those come back negative and they're showing symptoms, we want to be able to provide a COVID-19 test. And everybody is working very hard toward that goal. I've talked to a number of other governors. I've talked directly with the vice president. Every state is having this issue right now, but I think we're getting closer and closer to resolving it.
Governor, I think state employees obviously are critical to your mission, especially in certain departments. And it's early in the year. We're encouraging people, if they feel the slightest bit sick, to not take a chance here and stay out of work. You know, it's early in the year. A lot of people don't want to take up their sick leave this early. Sure. Would you consider at all helping state employees by saying, if you're sick right now, we'll give you some credit? I mean, is that
these are the things that HR is working through right now, is how to apply sick leave and what kind of exceptions that can be made regarding this new virus. So yes, all of those issues are on the table right now. We want the health and safety of our state employees and all the people of North Carolina is our #1 priority, and we want to make sure that we do things to help that happen.
This question is probably for Dr. Cohen or Dr. Tilson. Have you guys had any sort of conversation or heard from the CDC, from anybody who has survived coronavirus, or they're sharing any information with you that perhaps can alleviate some of the concern that people have at home, who think that if they do get it, there's a, albeit death or that their chances of survival are extremely slim?
So what I would say is, as we learn more about the virus, what we are seeing by and large, that if you look at everyone who gets the virus, about 80% of people have an illness that is not severe, not something that would require medical attention, and so that is mild to moderate. They're ill, but they're able to recover. About 20% of folks are ones that are needing our medical attention, and then we look at who are the folks that need really high levels of medical attention, like oxygen, intensive care unit, and then unfortunately, like the worst, obviously, outcome is death. So we are looking very closely. Those numbers right now for the virus are bouncing around as we learn more about this virus and how it works. But I would say the vast majority of folks are going to have illnesses that will make them sick, but they will recover without needing any medical intervention. But what we are doing right now is we are saying that there are folks who are at higher risk for severe disease, and those are the folks 65 and older and ones with chronic disease. Those are the folks, not that they're more likely to get it, but if they do, they are more likely to be in that category of being very sick. That is why our recommendations today are focused on those folks. Not that they're more likely to get it, but they are more likely to fall in that 20% of more severe illness, and we want to prevent that as much as possible.
We're also hearing folks are recommending getting the pneumonia shot or vaccine, rather. Does that have any?
Well, that's been a long-standing guidance of primary care doctors like myself to get those with the appropriate recommendations. Right, it's above 50 that folks should be getting that regardless. Yes, we should protect ourselves from the things that were out there. Get your flu shot, get your pneumovax. Those kinds of things are still very much recommendations that we will continue to make because we want to protect ourselves. And again, the more folks are protecting themselves from illnesses, we have vaccines, we have medicines, right? It'll allow us to make sure we have the capacity for this new thing where we don't have a medicine and we don't have a vaccine.
Did you say above 50 for the
I think
pneumonia shot?
is it 60?
Because
So let me get back to you on the pneumovax.
My GP just told me 65.
Was it 65? Okay, all right, my bad. Go with 65. The Dr. Tilson, I should not try to bring up my primary care knowledge on the spot. There you go. Thank you. 65. Get your pneumovax.
You want to clarify, so all 7 who have tested positive are adults in the state?
They are adults.
I had a follow-up on the testing numbers, just to make sure I'm clear, because you're talking about LabCorp now helping up. Are those tests also included in the numbers? No. Okay. And when you said 44, I think, Dr. Tilson, you were addressing those before. The 44, does that include the 19 that we talked about on Friday? If you just help me with how many so far, how many are in the...
Yeah.
Okay.
And again, this is changing literally minute by minute. So as of 11:45 a.m., it is probably out of date. As of 11:45 a.m., we have tested a total of 44 people. And that's total, so inclusive of.
Okay, and in
yeah,
terms
total
of
44. Yeah.
300 tests available, I think is
Yep.
what we started talking about.
Yep.
Does that include the LabCorp supply that's coming into?
So okay,
play?
so these numbers are specific to our state lab capability. The numbers of testing and our supplies specifically to our state lab facility. So we've tested 44 people at our state lab. We have another 25 in the queue at our state lab today. We have, because the FDA gave us some permission to do the test a little bit differently, we have current supplies to test in another 300 people. We have the extractor supply that Dr. Cohen mentioned, we are a back order. We've put 180, an order for 180, and it's on back order from the CDC. But however, we do think we'll be able to get 90 supplies for additional 90 people from that other commercial supplier that we had discussed earlier. And then once we go to this different process, and once approval, we hope by next week we'll be able to have sufficient supplies to test an additional maybe 1,500 people as of next week, assuming approval and assuming we bring that online.
And I'm sorry, last question on this. So health departments that have said, hey, we're working with LabCorp now, where do those tests go? Do they end up going through the state lab, or do they end up going somewhere else?
No, sir. So the actual, the swab that you do of the person goes to LabCorp. We don't process them. However, anytime anybody is suspected of having COVID-19, it is a reportable disease, we get notified, we know about it, and then if it's a positive, then we will also know of that positive result. We will not know if it's a negative result, but we'll know it's a positive result, and then we'll be notified of it. But they don't have to go through us. They can directly go through LabCorp. So that would really help some of our capability and capacity.
So the 44, there are a lot more tests that are going on right now across the state. Is that fair to say?
Through LabCorp, yes, sir. Yes, sir. But
Okay.
we don't know of any positives yet.
Okay.
Yes.
Jay Price, North Carolina Public Radio. First, Governor, you opened the news conference here talking about the latest 5 cases and said that we could probably expect some more out of that. I guess the Boston conference that these folks go out to. Are those additional cases people here that they had contact with, or someone else had contact with here, or are they more people who travel to Boston?
We'll let them do that.
So this additional 5, so there was a Biogen conference in Boston, and those 5 people were there and came back, and now have had tested positive. We just learned about them last night, so right now our local health departments will be doing that hard work that they do in terms of talking with the person, understanding where they went, doing that contact tracing, doing that monitoring. So they're just starting in that work now of that monitoring and follow-up. So your question?
You guys expect more. That's not just we're out there doing hard work with public health, checking who they got contact with. That's things look like we're going to get more.
I mean, I think we're going to, as we've been talking about, I think we're going to start seeing more across the state, maybe related to this one particular conference, but also I think we'll start seeing more across the state from other exposures as well.
And regardless of the additional testing that's going on by the private company, it sounds like there haven't been a ton of tests. It sounds like you guys are trying to look at the room through a keyhole here. Am I wrong in just saying you don't have any idea at all how many cases there are out there? There might be hundreds or thousands at this point. There's just not enough testing to kind of pin down any sort of reliable picture.
Well, I think what you're seeing is as we step up our activities here is exactly that. We don't want to be limited by just what we're seeing in the tests. So the governor having the executive order to declare the state of emergency, us standing up the Emergency Operations Center, and for us taking the step, particularly in the Triangle area, of saying let's move to some new recommendations where we'd like to see employers and employees use telework as much as possible, where we're actually recommending mass gatherings that are targeted to high-risk folks. We're asking them to take them down. I think what you are seeing is a step up our posture in that even in the low number of cases we have, just because of what we are seeing in other states and around the world, right? As we see things are escalating, even if we don't yet have the level of testing that we would want to, and we are accelerating that, we want to make sure that we are taking the appropriate steps early in the spread to do as much containment as we possibly can. So we know that there are more cases out there, and I think that is why we are stepping up our activities right now that you are seeing, and we want folks to take this seriously, to do the hand washing, to do the social distancing, for folks particularly who are at high risk of getting severe severe impacts of this disease, to really take this seriously and to listen to these recommendations, particularly in the Triangle area.
And lastly, RDU, we have a lot of international flights coming in still and domestic flights coming. People who are hopping in from other countries and other states that have larger problems. Has there been discussion of screening at RDU or upping the level of scrutiny there?
I don't know. I don't know the answer to that, but what I would say is the returning travelers that have been coming from international destinations have been funneled to 11 airports, none of which are here in North Carolina. But we know that the virus is in a lot more places now, and we haven't seen the increase in the level of screening. Those are responsibilities at the federal level, and CDC makes those determinations. I think that's why we are stepping up our guidance to say for those who are returning to do that self-monitoring themselves, even if no one says at the airport self-monitor. We're saying out loud today that folks who are coming from impacted areas, both internationally and domestically, to do that self-monitoring, and that they should be looking for guidance. I would also say things are changing every hour, day. We may have more guidance for you tomorrow that looks different based on the information that we have, both from the CDC, from other states, and what's going around on internationally. So I'd say stay tuned for additional information as we work through this.
Dr. Cohen, earlier you had mentioned that nobody is immune from the coronavirus. If someone contracts it and then ends up surviving it, are they then immune to it at all, or do they have the risk of catching it again at all?
Yeah, no, it's a great question. We're still at the very beginning of this, and we don't understand all the things that we would like to about the virus, and I think those are things that we're going to try to understand. Viruses can change very slightly as they work through populations, and so it's still unclear to us, will there be variations on the virus? I think that's getting ahead of ourselves. I think we want to focus on the issue at hand, which is making sure that folks are focused on the guidance, doing the appropriate things to protect themselves, particularly if they're at high risk at the moment.
And also, just to piggyback on high risk, I know we've said 65 and older. What about for infants or newborns who haven't quite built up that immune system just yet?
Yeah, so what we are seeing, again, we can only rely on the information we have from where the virus has impacted others. We're not seeing cases in children or in infants to the greatest extent. We're not exactly sure why yet. That's the research that's going on now to understand it. But it's good news that we don't see as many cases of children. We're not sure if that's because it's subclinical, meaning that they have it and they're not showing symptoms, or they're not getting it at all. I think those are the things we need to suss out. Either way, we know that the high-risk group are for those that are 65 and older, and those with chronic diseases like heart disease, lung disease, and something like diabetes or a weakened immune system.
Time for one more question.
Governor, are we, seems like you're having to walk a fine line. You know, we have to be concerned about commerce in our state, obviously. You don't want to cancel all public events. Does it concern you that we're not doing that? And is there some point where you may have to do that?
We need to rely on data and the science that we have. And what we've done today with this executive order and with the recommendations that we're making are based upon the science and the data that we have. And I think that